Hi, everyone, and welcome to the very first episode of the HEALTHCARE STARcast, where we go beyond ratings and toward excellence in healthcare. I'm incredibly excited to kick off this journey with a leader who truly needs no introduction. Subbu, over the last 2 decades, has built, led, and transformed some of the most complex star ratings and risk adjustment programs in the country, all while keeping mission, values, and impact at the center of it. But today's episode isn't about metrics or frameworks, not yet. This one's about the human behind the show. We'll dive into Subbu's story. So settle in. This is the beginning of something very special. Subbu, welcome. Thank you so much for being here today. And I'm excited to learn a little bit more about you and everything that you've done so far in your career. I know you've worn so many hats: executive, coach, analyst, founder. But before we dive into today's episode fully, I'd love to know a little bit more about who you were before all of that, where you were born and raised, and were either of your parents an entrepreneur or entrepreneurs?
Thanks, Lilo. Excited to be here and talking to you about my personal journey and star ratings and beyond. So I grew up in a city called Chennai, India, in southern part of India, and lived most of my childhood days and youthful days there. And my dad was the first entrepreneur in the family. Started his business in late 80s, where being an entrepreneur was very, very tough. So really grew up listening to the entrepreneurial stories as a only child to my parents. So day in and day out was stories of successes, failures, day-to-day work, and knew how entrepreneurial journeys could be really, really tough for the family and for the person. Yet it's very rewarding in general. So I, as you said, also an executive coach, been an executive in large multi-billion dollar companies, and also worn different hats. My journey in career started after my grad school, worked in one of the largest data transformation initiatives in the world. At that time, it was JP Morgan Chase. They were consolidating all their client data across the geographies. And I started working as a consultant for them in India. And then moved here for implementation from 2004 until 2000 when we stabilized it for JP Morgan. And then right after, very exciting at that time, even before Apple Pay, digital payments that we pay every day was a thing. I actually worked for a number of years standing up one of the first mobile digital payment technology for Barclays Bank and a number of other projects along with that. So really, almost a decade, and I worked in the fintech space, for these companies. It was fun. And then came healthcare. Accidentally. I'm actually based in Philadelphia. Started working for a company here, Independence Blue Cross. About the time when Affordable Care Act was just passed in 2010. And at that time, Medicare Advantage star ratings was very new, just the beginning phases of it, from Center for Medicaid and Medicaid Services, CMS. Risk adjustment was already there, but at the same time, it was undergoing more evolution. We'll talk about that more as during this conversation. So within healthcare, many of my skills came together, which was a cool thing. And sometimes you can always connect the dots later, right? So as I connected the dots later, so the technology skills and data and also people management, I love kind of interacting with stakeholders and getting people on the same page for the same mission, for the team and the organization, bringing the right culture and right team in place for the ultimate results. And it's not only for, from a revenue or the bottom line or top line, perspective, but also community health is something that I always, kind of thrived and kind of like thinking about it and getting better from a population health standpoint. So these are complex concepts, complex things, and I always loved a challenge. So that actually kept me in healthcare, in this world of population health management or value-based care. since 2010. So I've worn several hats in the health plan side and also worked on the vendor side. So I have a unique perspective being on both sides and looking at the big picture and also equally comfortable with all the details at the same time.
That's amazing. That's definitely a lot of hats, a lot of transitions, especially and then coming to a whole new country and being so successful. That is very admirable. And in a way, it's kind of interesting to me because my background is very different than yours, but the way in which you've done so many different things and at this point has essentially everything has kind of worked itself to come together is very similar to me. I graduated with my bachelor's in psychology and communication arts, and post college, I actually started working in like a sales and marketing company, which really wasn't for me. And this was after a few years doing retail. So I always loved like interacting with people and helping people and just having that in-person connection. After that, after I graduated, I wound up kind of stumbling into the healthcare world as well. I had really no experience in it, and coming from my sales job in very corporate setting, found myself working at a call center for Weill Cornell Medical Center, which was very high volume. And I learned so much about different areas of healthcare. Not only am I learning about different healthcare providers and how they manage their offices, but I'm also dealing with clients, or patients rather, and their pain points of getting access to their provider. And I was essentially the middleman. So I learned so much about that whole world in its entirety. And at the same time, I was actually the sole caretaker for my grandfather. So I'm also going through that experience of taking care of him and figuring out and dealing with the pain points that he's going through because I am his caretaker. I'm the one scheduling his appointments and on that end of things. And he was a veteran. So dealing with Veterans Association and scheduling appointments and scheduling pickups. So that was really a different experience for me, which ironically somehow led me into tech healthcare. So I wound up in the tech space, which is actually how I met Vivek. And it really stemmed from there because I'm on, for the longest time, almost a decade, on the, customer side, client facing role of the tech world. So I'm understanding what needs to be fixed to help the client and help the patient because it's always been a patient facing app or website. So it's very interesting how I can relate in that sense to how everything kind of comes together. And now here I am working with providers and different people from different walks of lives with hosting podcasts, which ties in so well to my background in psychology because I do work with a lot of therapists now, and communication, which was something I always wanted to get into. Or making films and things like that, and just having this like on-screen connection, whether it's behind the scenes or in front. But it's so funny how life leads you in different ways, and it's awesome when it can somehow all end up together.
It's cool to hear your story. And this is something that you've experienced as a caretaker and, being in the front lines of healthcare system. It's a tough job out there, right? So I think ultimately, whether somebody's an executive, somebody's a director, somebody's a, manager, somebody's an analyst, or someone making these decisions, it all impacts the frontline people who are delivering care, whether you're a clinician, whether you're delivering food, whether you're picking up a phone or having, taking care of your loved ones or taking care of others in a different capacity. That's the ultimate goal, right? This will be a conversation not only in this episode, but also in future episodes on how we can do that better.
Absolutely. And being that you've worn so many hats and you've done so many different things, what was the first moment when you realized that healthcare was where you were meant to be, and it wasn't just your job, but it was really a purpose?
Yeah, it's a really interesting one. A couple of incidents, I would say. It's like sometimes it's not just the one thing. It's like multiple things all come together. I think two, I would say, top things. Number one, until like about 2009, 2010, I didn't have a big idea of all the different healthcare system until I was actually working in the financial services in the industry. As a consumer and also caretaker of my parents, being an only child, it's always top of my mind. But at the same time, after I joined Independence and actually started looking at the population and more of an analyst and also trying to bring people together, and then, quickly came into a leadership role. I don't know if people have been in some parts of northeast part of Philadelphia, southern Jersey, and in right across the bridge, Chester County. It's a really, really a tough population. So if you look at the chronic disease of people and you see it in working in risk adjustment, working in really managed care plan, you see the cost and you see all the real kind of behind all the numbers, all the real diseases going on in your area around you, the zip codes around you. And at the same time, I also started being involved in a nonprofit that is outside of my main work through one of my awesome, colleague, Dr. Russo. We both, were involved in, a nonprofit charity work to do pediatric heart surgery in Africa and India. So, I saw a lot of amazing stories and, that lot of these amazing kids whose lives changed, because of the work that we did. Even still, we get letters, around the work that our organization did. So both combined, it gave me a local perspective in the context of U.S. managed care healthcare system, and also globally in Africa and India, what things were really going on. And that is where, to answer your question, it's okay, this is something that's much more meaningful rather than actually more on the financial side of things. And this requires sophistication in terms of data technology, etc., to make things easy. But also humanizing, things, and a lot of waste in healthcare, cost in healthcare. So I think those were multiple, two highlighting moments, I would say, that actually kind of, brought a lot of, kind of purpose to the work that I do.
Yeah, that's incredible. And I've always been also interested in getting more into nonprofit work. I think that it's something so necessary and so rewarding as well. And I know we haven't talked too much about Vivega yet, but I would love to learn a little bit more about that and hear your perception of it or your explanation a little bit more in depth. I know you kind of touched on some principles so far, but you've also talked about clarity and prioritization and principles that are really rooted in Vivega. So what does it stand for actually? And where did those values really come from?
Yeah, to set things in context for people who may be new to this. So from a healthcare perspective, I'm the CEO of Vivega Business Services, which is my company. But at the same time, through that, I'm also managing director for a company called Addict Consulting Group. So I lead the stars and risk adjustment practice there. And also outside of that, I have a executive leadership, coaching business, that is separate. But we're talking about both Vivega and Addict, consulting group. The name Vivega as a company and also as a concept, is rooted around clarity and prioritization. So the concept of Vivega is a concept in yoga. It's about clarity, ability to prioritize things, wisely, really. And for me, it started as a kid, growing up, with values in the books of, Swami Vivekananda. So, gained international fame in a speech back in 1893, I think around that time, to the Parliament of World Religions in Chicago. And many of the things that he talked about is nothing religious at all. It's just pure life. And he started with the words Sisters and Brothers of America. And his address really shook the whole community. And it's a very popular, speech that he did. And He talked about religious tolerance and universal acceptance, emphasizing that all religions lead to the same truth. You see what are the things that are going on, around our worlds, right? There are conflicts happening because of religion, but he was actually going beyond that. So his message resonated deeply with people, with Western audiences. He was also a pioneer in bringing the concept of yoga to the West. The yoga that we practice now with its physical form and all the things, in the West, he was actually one of the main pioneers who actually brought it, to the West. And I grew up reading a lot about him and all that. So that was my childhood, and always wanted that clarity and prayer, and always rituals that actually really leads to Viveka, which is clarity, prioritization, ability to prioritize, ability to synthesize things, ability to look clarity from chaos. So that concept is very applicable in several walks of our life, whether it's in our personal life, whether it's in a team setting, and especially in healthcare. It's
Absolutely.
so whether it's actually technology, data, process, policy, etc. So you have so many things to keep track of. And that's the framework I bring in all the different engagements that I lead, is the concept of Viveka.
I love how you tied that all together. That is really, really special. And even that is, like you said, is so applicable. It really is, because in order for you to wear so many hats, and you rattled off such a long list of things that you're actively involved in doing, that makes so much sense to have. You need clarity and to have strong prioritization and have that still in the chaos when you do so many things. I was kind of blown away by all the things you were doing. I was like, wow, he must have very incredible time management skills, because how do you do all of that simultaneously? So that makes a lot of sense. And I love how you really brought all of that together and intertwined things that you have close to you in your regular life and things that you practice in childhood to bring into your own business is super, super unique. And the way it just all worked so well together is very, very interesting. And I know there's a lot of different parts that go into the healthcare industry and things of that nature. And why do you believe that it's time for more healthcare operators and executives to stop thinking in silos and connect STAR, risk, quality, and revenue as one system, as opposed to different silos?
Yeah. So let's start, I would say, with the state of U.S. healthcare right now, right? So unfortunately, it's not a good news, right? But we have to start with the truth. Our diabetes or prediabetes affect over half of U.S. adults. This is according to the latest, 2025 report from CDC. Our cardiovascular disease related deaths every 34 seconds. We've had, at least few minutes every 34 seconds is a death around cardiovascular, disease just in the U.S. 71% of adults are overweight or obese, compared to 59% of global adults in the past. Direct or indirect cost for cardiovascular disease is about $418 billion. So I'm just rattling just very key. There's a lot of things that we can talk about here, but I'm mentioning this for a purpose, right? We all know it is challenging in the state of chronic disease, but imagine if a managed care company is working on getting better at chronic, managing chronic disease for the population. It has to be coordinated, right? It's easily said than done. Obviously, it has to be coordinated. So to answer your questions, star ratings is a way to improve health plan quality, period. Right? There are technicalities within star ratings from CMS, which is not perfect, so there are lots of complexities to it. And the risk adjustment is a way of making sure, health plans get the right payment and all the chronic disease and the conditions that the members have are accurate, so that the cost can be predicted really well. And then the outcomes can be tracked really well. And then the outcomes for the population can be impacted through this data, whether it's through the provider or through the health plan directly or working with the member. So all of these are really a concept of population health management, which is really the process of improving the clinical outcomes for a group of individuals, by coordinating care, engaging members of patients, and utilizing appropriate financial and, healthcare models, right? So that impacts quality of care, within, star ratings is a subset of it in Medicare Advantage, under broader quality concept. Accurate documentation, revenue, risk adjustment, cost, and then you add other things to it, right? It could be health equity, it could be, provider satisfaction, you name it, right? So there are multiple ways to look at it, but ultimately it's population health management, right? So all these parallel tracks going, it has to be coordinated, it has to be looked at it at a holistic lens. And these are tough concepts from a technical perspective, from a clinical perspective. So even the people who are running these organizations, people who are behind these organizations, we need to upskill. Right. So it is a journey, and that's why it needs to be looked at it really well, holistically together.
Absolutely. And you've built one of the most high performing star risk teams at Care First, from a team of 1 to 60 plus. You've also improved outcomes and reached up to 4.5 stars out of 5 in your previous roles before Care First. What's something that you learned the hard way in that journey?
So, I always think about, from a framework of, teams, and companies gotta have the right people or hire the right people. So people first. Process, either have to have, already an existing process or a way to kind of improving the process or establish a completely new process. The right technology, the technology needs to evolve, and also even if it's like super high technology, it needs to meet the purpose of that technology, right? Be it better phone calls or better outreach to members who are in need. It needs to be there to serve them when they need it, where they need it, and in terms of the giving the right clinical outcome too, right? So, and then culture. Fourth is culture, having the right culture, not only within a, small set of teams, but also culture as, as an ecosystem, within an organization or in a community. And the last one is really overall strategy of like, what's the plan? If there's a managed care company, are we kind of looking at it, timing it the right way to entry into a market? Are you finding the right, putting the right kind of benefits in place? So from a health plan perspective or healthcare ACO or provider perspective, these 5 things needs to go together: people, process, technology, culture, and overall strategy. So I think that those are the levers that you pull, right? So making sure that I've been lucky kind of hiring the right people and bringing on the right people. And one of the biggest lesson that I would say, like, the hard journey that I've had is I've hired some really good, awesome people. And sometimes technology took time to really kind of get there, in a larger organization. And that could burn out people, right? So you have the awesome people and you don't have the right technology and you don't have the right data, you're just wasting the talent, right? And even if you have the people who have the right ability to bring the right technology or implement technology, if they are really buried in bureaucracy, that'll kind of demotivate them. So I think those are things that I've actually learned the hard way, to kind of bring all those kind of levers together at the same time. But yeah, I think from learnings, you apply the learnings to some of the next job that you do. And that's something that I'm really proud of, to kind of like continue to implement the learnings that I've had in the last couple of decades and bring all of these together. It's almost like if you're having a sound system, you have to have the right equalizer to kind of like have the perfect sound that you can hear. So that it's a little bit of tinkering here and there. And that's something that you learn the hard way, right? You can learn all these concepts, but people have to experience it and run it and build it, and learn from experience.
No, absolutely. I think that is so true. Having worked in tech startups for almost a decade at this point, that I can only agree a million times over how true that is. And it's very hard to get those things to sync up well. Because like you said, you could have great talent and not the right process. And in my experience in working at startups, you're trying to find the right technology to work for the patients and for the providers and for the internal team. So that in itself is a lot to combine. And then building processes that are going to benefit the patient, benefit the provider, but also grow the business, and finding the right people to build out culture and have everything mesh well is extremely difficult. I've experienced that firsthand, and not as a founder, as an employee. And I can only imagine how hard that is. I've worked really closely with all my CEOs to actually help those things, and researching the right technology and brainstorming the right processes and finding the right people. And sometimes they overlap, and sometimes you don't have the right things at the right time. So it's very, very hard to find it all. But when it does work, when you finally find that, it's like magic. And it's hard. I completely understand. And what happens when a health plan optimizes risk adjustment but ignores STAR strategy, or vice versa?
Yeah. So I think it's, I think I'll bring up pertinent point right now, in the industry. Star ratings takes time, right? In terms of like, the impact that you can have for the work that you do now. But it's also every day. Every second counts. Every day counts. It's operational in nature, but it's also very strategic in nature, because the outcome takes, in certain instances, 2-3 years to really see the outcome in the star rating, the results. For example, this October, we'll see the public release of the star ratings in the industry, but that's work done last year, in some cases previous year, that in some cases 2 years before that, when some of the companies set up their new operations, like call center. Some of the companies set up a new benefit. It could be a transportation benefit that was set up 2 years ago. That's actually paying the dividends now if it's done well. So it's a longer time to make an impact. So in the case of risk adjustment star ratings, take for example, there's actually a huge release of Medicare risk adjustment audits that CMS is going to audit many plans very soon. There was a press release a few weeks ago, and followed by a memo, and that's coming. It's coming in hot. CMS is going to catch up with audits on risk adjustment for the last 5 years, and they're going to do it on a recurring basis moving forward. And that's a lot of money in terms of health plans potentially giving back to the federal government based on this audit, right? So billions of dollars at stake here. At the same time, when you're working on the STAR strategy, so you have to invest in the work that you need to do to improve quality, but at the same time, making sure that your risk adjustment is just not about just looking for revenue. It's making sure it's accurate codes that you're submitting, making sure that you're ready for any audits that are come through, and there's investment in that, right? So there's strategy in that, there's operations in that. So I think that's one example where both the teams, not only both the teams, but people who work in the cost area, people who work in the compliance area, all need to come together and look at this and prioritize, what are the next best actions across to impact all these areas,
Absolutely. And from a patient's experience lens, what seems to get lost when quality and revenue and cost are tracked in different silos or separate silos?
That is a great question, right? That is ultimately what we're all here for, is for the member and the patient to not only get the experience that they need, but the care that they need. Imagine there's a patient or a member who's actually just trying to get their diabetes medication at the point of, somewhere, whether they're going to send it home, or they're going to go to a local CVS or Walgreens or their local pharmacy, right? So all they need is just to get that, the medication. When it comes to quality, there is actually a medication adherence measure tied to it, within STARS. There's actually a CAPS, customer experience component, CAPS, which impacts star rating, comes into it. There's an aspect of documentation that comes into it, if is the member diabetic, right? Either the member accurately documented as diabetic, risk adjustment component, comes into it. And then the cost of care comes into it. How is the cost for the medication? We're talking about diabetes medication, which could be, not that expensive, but at the same time, you think about other conditions that, surrounds it, right? That the members are in insulin, etc. Things add up. The cost of care component comes into it. Is the benefit right? So all of these you think about it from a health plan, side, right? So if the quality, teams are looking at it, hey, I want to get their medication adherence up and their experience up. Risk adjustment is looking at, I want to make sure like it's documented correctly, and the cost of care and benefit side are looking at it, from a different lens. Member doesn't care about all these lenses. They just want to get the medication, right? And just make sure their chronic disease that they have, they are making a progress in, reduction, the complexity of the chronic disease on being well. That's what they care of, right? So in each of these different tracks, people are trying to reach out to the member or work with the provider, etc. But that's the patient lens, right? So ultimately, if you pull the curtains of the, or the health plan, that is what we need to be solving for, right? So if member Jane Doe or patient Jane Doe is, getting the medication, how can we put all of our heads together and make sure like that medication is at Jane Doe's hands. And it impacts also all the aspects.
Simplifying it, when things are all separate, it doesn't benefit anyone, pretty much. It's just, with the healthcare tech companies I've worked in, essentially, as different as they were, the similarity is that the healthcare system can be so broken in different ways and different aspects that everything needs to be simplified. So having that simplified and really, in a way, streamlining that makes the patient experience better, but also makes it work seamlessly better for everyone involved in getting Jane Doe her medication. So it's super, super important things that are happening on the back end for the benefit of the patient. And let's say that someone listening right now, one of our listeners out there, runs Star strategy for a health plan, but they've really barely talked to the risk adjustment side. What should their first move be tomorrow, or vice versa?
Yeah. So, definitely people who run Star strategy, I'm hoping that they're talking to their risk adjustment people very, very on a regular basis. And they, apart from just talking, they're sharing data on a member level basis, and they're tied to the hip, right? In a way. But if not, then their first move would be to say to the risk adjustment side, how can they help with the RAD-B audit? Right? How can they help to make sure on the risk adjustment side, when in the Star side of things, there's a lot of also data collection happening from a provider engagement standpoint, and how can they help to ensure that things are documented correctly? If they have resources to improve within Stars, there's also HEDIS. They have resources to kind of like go out there and improve HEDIS measures, whether it's through data collection, through clinical data exchanges, etc. How can they help to also to impact that on the risk adjustment side, especially from a context of risk adjustment data validation audit, RAD-B, that's coming, coming down really fast, right? That's the one question that I would ask. Start from there. How can we help? And just really over time, just get tied to the hip.
Absolutely. That's great advice. Let's say, speaking of advice, let's say you're mentoring a first-time VP or leader of risk adjustment, and they have, let's say, 6 months to really prove themselves. What would you tell them to do first?
So I think in the framework that I talked about, people, process, technology, and then we talk about people, process, technology all the time, right? But at the same time, culture and strategy, right? Combine that together. That's in a framework to kind of really kind of think about like, are all of these aligned, right? And it may not be, right? So I've been there myself. Sometimes it's 2 out of 10, sometimes 5 out of 10. So that's a very, very basic start. Right. And they have 6 months to, prove themselves, really kind of understand, especially from a context of risk adjustment. Number one, are their process and procedure really ready? Is it industry standard? If not, seek help to get that, squared away right away. right? Because it's going to be very, very important in the context of whether it's a Medicare Advantage audit or RIB audits, etc. And then the second part of it is, do you have the right, apart from infrastructure, for the, not only for the rest of the year, but also for the following year, do you have all the right resources? Do you have all the money to really, kind of improve all the different numbers that you have to move? Numbers not only from a revenue standpoint, but also kind of like accuracy standpoint, right? So typically the budget season would start shortly after summer. My advice, given the 6 months time frame, let's say somebody started, last week, advise them to really kind of start cracking at the 2026 budget. The third thing is keep very, very close tabs on the policy changes. What is happening? What are the changes happening that are going to impact the plan right now and in the future? The fourth is actually developing trust. This is developing trust not only with your own boss, but also with all your peers, that you're working with. Developing trust with the CFO, developing trust with the plan P&L leader who he or she is actually kind of funding for all of these initiatives. That's what I would do. If then the trust is, typically developed when you give results. Sometimes the results, for the work may not show up later, but there could be other leading indicators that shows all the results that would come down the line. It could be a year from now or 2 years from now. So any indicators on a regular and a consistent basis, give it to I call it stakeholders, but at the same time, your peers and people who are really invested in this role. Yeah. So trust goes a long way.
Absolutely. And there's a lot of noise in healthcare right now, especially in the managed care space, with many changes and uncertainties happening with the new administration and hype in AI and how AI is taking over so much. And also in Medicare Advantage audits, what are some of your thoughts in terms of navigating the existing complexity and your thoughts on simplifying it in the future?
Yeah. So that's a big question, right? Simplifying the future with all these complexity. First and foremost, I think we talked about the Medicare Advantage audits, already like consulting group as part of the group. Like we also support health plans with Medicare Advantage audits, not only from an advisory standpoint, but also from, in an execution standpoint. That is something that I would say give Attic a call, reach out, or just think about how you can create a capacity. People can create capacity to really kind of make sure people are ready to kind of support the influx of audits coming in. Outside of that, there hype in AI, you talked about sometimes flashy stuff may not be the immediate thing to kind of really focus on, right? So really, AI would really help when the underlying data is really clean and really good. It all starts from there. So what I would advise is about, I'm an optimist. There are so many good things depending on what aspect of AI you're talking about. There are, process improvements, etc., that can happen through AI, which I'm actually bullish about. But at the same time, in the context of healthcare, it could be very tricky. Right? Very tricky. So you need to be, let's say, caution, implement any AI, enablement in a very trusted pilot environment. So it doesn't actually really, impact, negatively the care that's, given to the population. And not too many hallucinations, etc. But I think small pilots are fantastic. Think about small pilots that can actually really improve some process outcomes and then see how it can be scaled in the future. That also kind of gives trust to people. Right. So small things, you can see how it works and develop trust over time before putting in the major investments. The last but the least, so many changes with Medicaid, potential impacts, but a lot of the changes happening, at the federal government level. So seek help. I would say, if I'm not an expert in something, I reach out to somebody else. I think seek help, but at the same time, seek help with people who have authority, clarity, and, also don't waste too much money on seeking help, at the same time. So those are three things right now. It's a lot of things evolving. It's going to be, in the next few months, we will be talking about that in this podcast as well. I think in the next, the podcast will dig a little bit more deeper on the Medicare Advantage audits, and any related, things that are going on in CMS, with a few other colleagues as well. So I look forward to share more, about this and discussing about this complexity and see how we can simplify it in future.
Absolutely. Thank you, Subbu, so much for not just sharing your expertise on these subjects and how you've got here, but more so even thank you for sharing your why. I think it's so important for people in this industry to hear your expertise, but also have a little bit of an understanding of your why. And you've set the stage for what the show is really about: leadership, clarity, and helping healthcare evolve from the inside out. This is a wrap on episode 1 of the Healthcare StarCast. And what a powerful way to launch the series. I'm super excited about this. And to everyone listening, please consider subscribing or sharing it with a colleague or friend. Your support does help us a lot. And stay tuned. We've got a lot more in store. Thanks for joining us, and we'll see you next episode.